Ankle evaluation in active rheumatoid arthritis by ultrasound, a cross-sectional study. Elsaman AM1, Mostafa E2, Radwan AR1. Department of Rheumatology and Rehabilitation, Sohag University Hospital, Sohag, Egypt. Department of Rheumatology and Rehabilitation, South Valley University Hospital, Cana, Egypt. Abstract. Ankle joint evaluation is underestimated in many clinical and sonographic scores used for evaluation and follow-up of rheumatoid arthritis, RA, patients. Agreement on examination parameters is poor among sonographic scores, which include the ankle joint. More effort is needed to detect the value of ankle joint examination in RA and arrangement of ultrasonographic signs according to frequency, disease duration, and activity. The objective of this study was to use ultrasound, US, to detect ankle involvement in active RA and to compare findings with disease duration, disease activity, and assessment of ankle bones erosion. A total 63 active RA patients and 20 controls were included in the study. The tibiotalar and talonavicular joints were examined by US for synovitis and/or effusion in grayscale, GS, and power Doppler, PD, modes. The anterior, lateral, and posterior ankle tendons were examined for tenosynovitis and tendinosis. Mean age was 35.1 plus or minus 8.3 years. Mean disease duration 22.7 plus or minus 9.6 months. And mean DAS 28 ESR 28 score 3.05 plus or minus 0.66. Ankle involvement was seen in 28 patients, 44.4%. The most frequent pathologies detected were tenosynovitis, 30.2%, followed by synovitis, 18.3%, erosion, 8.7%, and tendinosis, 4%. The earliest sonographic signs were tenosynovitis, followed by synovitis, erosion, and lastly tendinosis. Right ankle showed higher involvement than the left ankle, which was significant regarding erosions, P equals 0.009. The commonest tendon affected by tenosynovitis was the tibialis anterior, 22.2%, followed by tibialis posterior, 20.6%. Tenosynovitis, especially of tibialis anterior and posterior, tibiotalar synovitis, and erosion should be considered for future US ankle score in RA patients.